instead of tennis elbow splint, what we apply, I advise to put a wrist splint because ECRB is the main culprit. So coming to our trigger finger release is very common and relatively very easy surgery, but more complication rate if not done properly. What are the types? It is congenital or adult. So congenital trigger finger, stage 1, a nota nodule node is present, but no triggering is observed. Stage 2, triggering is observed, but active extension of IP joint. Stage 3, active extension of IP joint is possible, and triggering is observed during passive extension. And stage 4 is passive extension of IP is not possible. So conservative, we advise stretching. If triggering or deformity not resolved, it is recommended that surgical release be performed before the age of 5 to prevent permanent contracture of IP joint. So this is the nota node, this point, yeah. So point to be remembered, be careful of digital nerve. So at the thumb, the digital nerve crosses and it has to be adult trigger finger, repetitive trauma, medical condition like RA, diabetes, hyperthyroid and amyloidosis. So this is the A1 pulley is the culprit. Again, Green's classification of severity. Grade 1 is pain, history of catching. Grade 2 is demonstrable catching, but can actively extend the digit. Grade 3 is demonstrable locking, requiring passive extension. And grade 4 is fixed flexion contracture. The symptoms are pain at the base of the thumb, finger or thumb, bump or nodule at the base of finger, stiffness, particularly in the morning, snapping or locking of sensation, and more severe cases requires reduction with the other hand to unlock. Diagnosis, history and physical examination, ultrasound and no need of X-ray. So non-operative treatment, NSAIDs, steroid injections, splint, ultrasonic. Trigger finger release under regional block, local block, wide awake surgery. So I usually do it in wide awake surgery, Valent. So a flexor tendon sheet block by plain xylocaine 2 ml and we do the surgery. So this is the Valent. So on table, we can see the release. So incomplete release or a digital nerve injury is the complication. 24 hours, we do a dressing. Tell patient to keep hand elevated above heart level. After 24 hours, change dressing. Do not take longitudinal incision, cross flexion crease, no transverse incision on the flexion crease. So I usually take an incision over here along the crease. Beware of the digital nerve. I don't know why the video is not running. So this is on table under Valent surgery. We can use it. We can see the release. So thank you so much.